Hello, everyone, and welcome to our webinar focusing on the harms of Medicare Advantage for both patients and physicians in our healthcare system. My name is Phil Verhoef, and I am the current president of Physicians for a National Health Program, or PNHP. I'm also an ICU physician based in Honolulu, Hawaii, and I care for critically ill children and adults. And so as everyone is filing in, please put your name and location in the chat so we can see where everyone in this webinar is coming from. And as we get started, I need to thank several of our allies that have been working with us on this webinar and campaign. First and foremost is Be a Hero. Many of you may be familiar with them as the nonprofit that the late Addie Barkan started to drive healthcare reform advocacy, and Be a Hero has been just such a partner in all of this. In addition, several other groups that you can see on the screen: Centers for Medicare Advocacy, Labor Campaign for Single Payer, Invisible, Social Security Works, the Center for Popular Democracy, People's Action. All of these have been just really partners in all of this. And so as a registered attendee, you will be receiving an email tomorrow with all of the slides that we present today, as well as a recording of today's webinar. And so allow me to tell you just for a couple of minutes why we chose to take this on. Remember, we're the only physician-led organization in the country that's devoted to advocacy for national health insurance, and we've been at this fight for almost 40 years. And we've known all along that the private insurance system is actually the problem and not the solution. But in the last decade, we've just seen shocking changes perpetuated by private insurers that have really been damaging both patients and clinicians. Doctors, nurses, pharmacists, therapists, anyone in the healthcare industry has been adversely affected by this. And today we're going to present some of the results of our recent report, really documenting the ways that private insurance is hurting some of our most vulnerable, our senior citizens on Medicare. But here's the crazy thing: the private insurance industry has been doing this in every element of how they work. And so, this profiteering has got to end. But it's even worse in Medicare Advantage because this is a government-sanctioned program, and we have oversight over this, and yet we're literally wasting our money supporting these programs, as you'll hear tonight. But before we get into all of it, it is really my great honor and pleasure to introduce Senator Elizabeth Warren. I'm sure she's a familiar face to most of you, but I'd like to point out that when she was elected now 12 years ago to the Senate, she was the first female ever from Massachusetts to serve as senator. She's been a stalwart supporter of PNHP's work over the years. She co-sponsored the Senate Medicare for All bill that Senator Sanders introduced back in 2018 and in every subsequent Congress. She's been a fighter against the ACO REACH program, the direct contracting program. She invited our president at the time, Susan Rogers, to testify. She co-authored the Bad Actors letter, which a lot of you got fired up about this last spring. She's led a Senate hearing on how we can protect and expand Medicare. And so she's been a real friend and a partner of PNHP's in our fight for universal, equitable, cost-effective public national health insurance. And so I'll turn the floor over to you, Senator Warren.
Well, thank you very much. I really appreciate it. And hello, PNHP. I am so glad to be here with all of you to be able to raise a very important topic, and that is Medicare Advantage. You know, over half of all seniors in Medicare are now choosing to enroll in Medicare Advantage, this federal program that allows private insurance companies to provide the Medicare coverage. Congress created Medicare Advantage on the premise that private insurers would make the program more efficient and would save the federal government money. Well, that didn't happen. Independent experts have found that over the course of the program's history, it has never saved the government one nickel, not one nickel. Instead, it has cost taxpayers hundreds of billions of dollars more to cover seniors in Medicare Advantage than it would have cost just to cover those very same seniors in traditional Medicare. In fact, PNHP found that Medicare Advantage overcharges taxpayers by up to $140 billion per year. Let me say that again, $140 billion a year. And it gets worse. Not only do corporate insurers in Medicare Advantage overcharge taxpayers for this coverage, they also routinely delay and deny seniors the very care that they are owed, all so that they can just make more money for themselves and juice their profits. It is shameful and it is harming our seniors. And this is why it is so important that PNHP is shining a light on this issue. For years now, powerful insurance companies have poured millions of dollars into lobbying efforts to protect themselves from scrutiny. And for a long time, the conventional wisdom in Washington was that Medicare Advantage is simply too powerful and too popular to take on. This has emboldened these corporate insurers. They've gotten bigger and bigger and greedier and greedier. But now, thanks to the work of PNHP and this grassroots movement that you are part of, the tide is actually shifting. More and more seniors are speaking out about misleading marketing tactics, about deceptive provider directories, and about dangerous delays and denials of care. And more providers are speaking out about how burdensome prior authorizations and payment denials contribute to widespread burnout among our healthcare professionals. More and more hospitals, nursing homes, and rehabs are raising the alarm right now about how corporate insurers' abusive tactics are literally pushing them to the financial brink. And the result? Federal officials, from members of Congress to the Biden administration, are finally beginning to take notice. The Biden administration has begun to take important steps to crack down on deceptive marketing in Medicare Advantage, and they have begun addressing overpayments to corporate insurers. Members of Congress are raising the alarm in hearings and through oversight. Now, look, we've got a lot of work ahead of us, but understand this. Together, we are building a powerful grassroots movement to take on the corporate insurers and to protect Medicare. And that is why my job tonight is to tell you exactly one thing: keep going. Keep sharing the stories about how corporate insurers in Medicare Advantage are harming your patients and your loved ones. Keep sounding the alarm about how corporate insurers are making it harder and harder for healthcare professionals to do their jobs. So call your members of Congress, let them know why this issue is important to you. Recruit your friends, recruit your colleagues, recruit everyone you can to join you in this fight. Together, that's how we will take on the corporate insurers and reclaim our Medicare so that everyone gets access to the high quality health care that they have earned. I just want to say to all of you, I am grateful to be in this fight with you because I believe that together we can get this done. Thank you.
Senator Warren, thank you so much. It's inspiring. It's inspiring to hear your words and to know that we have such an ally working this fight with us. It's we are winning. We are making a real difference, and it is really through our partnership with you and the incredible work that you've been doing along this. It's just such an honor to be working with you on this. So thank you so much for your time.
And thank you for all you're doing. Stay in this fight. We can win this.
We will. We will. Thank you so much. So next up, I wanna just show you a collection of some videos that we've put together, really demonstrating how much both patients and physicians are being hurt by the current Medicare Advantage program. And as you watch this, think about this. Think about these stories. Think about these experiences. You may have experienced them yourself, and know that this is what motivates us to continue in this fight. So let's, as we get this video going, I think this is you're going to be incredibly struck by this.
In 2021, my wife became very seriously ill very suddenly within a matter of 3 or 4 days, and she was diagnosed with category 4 brain cancer, glioblastoma, inoperable. From that point in time, it was a fight as to which hospital we were going to be in. Could we coordinate benefits between hospitals? What kind of treatment she could get as she got progressively worse? It was absolutely horrible.
When Medicare Advantage plans were first really taking off, we were listed as a network provider, and we weren't. The first person that showed up with this card, I looked it up and said, they show us as not in network. And they were furious because it was sold that we were in network. And they had done exactly that. It was bad enough, and they sold it to enough people locally that I reported it to CMS for contracting issues.
The worst part is dental. Trying to find a dentist was virtually impossible. Even the dentists that they listed as in their network, they just were not accepting new patients, at least when I told them that I was a Medicare Advantage patient.
I just recently had a patient who had a lot of chronic diseases, came in and needed a major abdominal surgery. Basically, our physical medicine and rehabilitation specialists evaluated her and said, this person needs acute rehab, but she has Medicare Advantage. And so insurance office steps in and says, no, she's healthy enough to not go to acute rehab. This is someone who miraculously survived this hospitalization. The only thing that's going to keep her out of the hospital is going to an acute rehab. And you're telling me, having never met this patient, that we're incorrect in that assessment. It's offensive. It's very difficult to have your judgment questioned by somebody who's never met the patient and whose interest is not in the care of that patient. It's in the distribution of these resources that this insurance company deems appropriate.
I learned more about this disadvantage of Medicare Advantage. We get worried. Access to a specialist, for example, may get restricted. My worry is now being upcoded. How much is going to be the Medigap cost? And then does the gap closed and seniors now get discriminated against based on their upcoded profiles?
They sit in the hospital, and then we try to come up with a different plan. So then it increases our length of stay, and then the patient can develop something else while they're here, like a hospital-acquired pneumonia. He was recced for acute rehab. He has MAP Humana HMO. He was medically ready last week, so the insurance denied him, and then we had to do an appeal, and we're waiting on the results, and he's been here for 20 days total. But of those 10, we've kind of been going back and forth with insurance. And then he developed pneumonia.
The Medicare Advantage plan at that time was trying to switch the patient from one calcium channel blocker to another, and also encourage them to get their drugs by mail order. In the wake of all of this shuffling around, the patient became confused about their medications, and the patient came in profoundly hypotensive. It was a pulling apart of the part of medicine that's most important, the doctor-patient relationship and the pharmacist-patient relationship. It was all about the dollar.
See, if you don't find this moving and infuriating, right? Like, this is crazy. This is the system in which we live. This is just a few stories, and this is why we fight. And honestly, we are winning. You may remember a couple of years ago, we launched a campaign against the ACO REACH and direct contracting programs. And as a result of our advocacy, they've shut them down. They are not expanding that program the way that they had originally planned to. And remember, our advocacy this last spring to keep CMS from raising those rates for Medicare Advantage resulted in a drop of insurance industry stocks as a result of our advocacy, because all of a sudden they found out they were not going to keep being able to milk this cash cow. And so we are winning. Our efforts are making a difference, but we need to keep building our power to finish this job. And that's where you come in. We need you to join us in this effort. And there are so many ways that you can help us in this. And so throughout this webinar, we're going to help you understand the 3 opportunities that you have to stand up for patients, physicians, and for Medicare itself. And the first one is this: share the news. Share the recording that we send to you tomorrow. Share our one-pagers with the materials that we have. Share these with your friends and with your colleagues to help them understand this problem. Second, speak up. Tell people about this, right? They need to know that this system is broken. that they need to know, that we need to hold our government accountable, stop wasting our money. And third, show up, whether it's legislative advocacy, if it's direct actions, if it's protests, if it's calling your legislators. We need you to be a part of demonstrating our numbers. This is not a fringe issue. This is something that literally affects everyone, right? Millions of Americans. And so, again, just to remind you, you will get tools to share all of this tomorrow. You're going to get, because you signed up, you're going to get an email with a video, with one-pagers, with tools to share this. And now we're going to launch a poll. We want to get you fired up. We need everyone on this webinar to share either the harms report and petition by texting it or emailing it, or print that one-pager, bring it to local community groups so that they understand this issue. Third, you could table with local activists this summer, engage with them on the importance of it, or finally forward this recording to anyone and everyone you know so that they understand the scope of the issue. This is how you can get involved. We have to keep this fight going. We have to build on our momentum. So now it's my great pleasure and my honor to introduce Dr. Ed Weisbart. He trained in family medicine. He's PNHP's board secretary. He's based in St. Louis. If you've ever given a PNHP talk, you've probably used one of Ed's slides because he makes all the incredible materials that we send out to you. He's been involved in legislative advocacy. He's just a fantastic advocate. So Ed, the floor is yours. Tell us some more about this campaign.
Well, thanks, Phil. Boy, powerful stuff that we've been starting off with. Thank you for all the things we've got going on here. So it's my pleasure to start to try to unpack the actual report that we produced. So we're going to spend just a few minutes going through that, but I need to start by, oh, I'm sorry, just a second here. Didn't mean for that to happen. I need to start by telling you about the great authors we have on it, the policy committee that worked hard with our with wonderful Gaurav. We also worked externally with a bunch of experts who were just honored to be able to have had help us guide us on this. We'd have dozens of folks who agreed to be interviewed and for whom you just saw a sampling of, and they really helped inform things. And then lastly, the study itself, the report itself includes dozens of public domain citations that you can find easily in there. What I wanted to point out about those citations is that the evidence is basically overwhelming that Medicare Advantage is harming people in general across the entire system. But also I wanted to point out that there isn't much public, almost no public information looking at individual Medicare Advantage plans. And that's important because some of you watching this video are possibly in a Medicare Advantage plan and may not have had the kinds of problems that I'm going to describe in a couple minutes. So you may not have run into those. That's either because you're in a better one and we don't know which ones are better or worse, or you may not have just yet run into the problems. I don't know. But the point is we have very little information about individual plans, and yet this stuff we're showing you applies nationally to across the entire system. So our main conclusion is that we thought that there were harms being perpetrated or conducted by Medicare Advantage on people, but we didn't quite understand the range and the depth of it. So I'm just going to give you a little taste of it. One of the most striking things we uncovered was that the death rate after some cancer surgeries is double for people in Medicare Advantage than for people in traditional Medicare. People who have cancer surgery, particularly in this case, pancreatic cancer surgery, but in several cancer surgeries, have significantly higher chances of dying after their surgery if they're in Medicare Advantage than if they are in traditional Medicare. And that's for a host of reasons, which we are unpacking in the report. The one, of course, is that the networks keep them from going to, frankly, the best hospitals and doctors in the country. If you have certain things, you want to go to a center of excellence, and people in Medicare Advantage are far less likely to be able to do that compared to people in traditional Medicare. We discovered that there are millions of people in Medicare Advantage who are underinsured, meaning that they have such high personal costs despite having this insurance that they've had to delay and deny and have their care denied. And these delays and avoidances of care are part of why the cancer surgery death rate is high. We discovered that there were more than 10 million, actually nearly 12 million people in Medicare Advantage who have this alleged insurance that actually excludes more than 70% of the physicians in their county. That's, again, one of the reasons why we see the increased death rates. And then lastly, that physicians and their practices were wasting tens of millions of hours a year just on the prior authorization process for Medicare Advantage. And you're going to hear a bit more about that. So these things are all interrelated. The prior authorizations, the narrow networks, the underinsurance, the delays and denials of care, and frankly, the increased death rates. This is no game. This is for real. Let's make it a little more clear what Medicare Advantage is just for a moment. So to make the point that it's not actually, in my mind, even Medicare. So traditional Medicare is as simple and efficient and equitable a system as you can want. We pay our taxes. We get our precious red, white, and blue Medicare card that we hold on to for dear life. And then Medicare pays physicians and hospitals on behalf of Medicare members. It's not quite as simple as this cartoon, but it is nearly as simple. Medicare Advantage is completely different. It's completely different. And so this is, again, a simplified cartoon, but it's complicated, it's harmful, as we'll show you, and it worsens disparities. So instead of Medicare paying your doctor or hospital if you're a patient, instead, Medicare prepays an insurance company, and then the insurance company pays the doctors and hospitals. So think about that. The insurance companies are prepaid. They have the money in their bank, and they don't want to let go of it. So every time they have to pay a doctor or a hospital on a patient's behalf, that's a cost. And that's not what they want to do. And a little more complicated than this cartoon, they don't actually pay every doctor and hospital. They, of course, tell patients you can use this doctor and not that doctor. So it's very complicated. And that complexity by itself is enough to say that Medicare Advantage is really not Medicare. So it does a number of things. It blocks access to physicians and hospitals, as I've said a couple of times, delays care, denies care, and that can kill you, actually. And only in Medicare Advantage do you start to see the HMO style tools like prior authorizations and other similar things. So if you've been running into much in the way of prior authorizations in Medicare, I promise you, you have Medicare Advantage and you do not have real Medicare. Real Medicare, traditional Medicare, doesn't actually do hardly any of that kind of stuff. And what most folks don't realize after they've been in Medicare Advantage for more than 12 months is that, yes, they can get back and go to traditional Medicare if they hate these prior authorizations or their network doesn't include whom they want. They can do that. But what most folks don't realize is that they're no longer guaranteed of being able to purchase a Medigap plan. And so they're almost trapped. You're almost trapped in Medicare Advantage, except for 4 states where you do have those guarantees. So these harms that we're unpacking here, these harms are not accidental. They are fundamental consequences of the business model that is Medicare Advantage and our other corporate profiteerings. This is how healthcare is supposed to work, right? Doctors and patients partnered together to get the best care. But instead, what we're finding and what we reported on is this whole range of harms that Medicare Advantage firms introduce to this relationship. I'm not going to unpack these today. I recommend you read the report, but there's more than this in it. The key that I'm saying right now, though, is that most folks, when they're opting into Medicare Advantage, don't know they're making the decision to expose themselves to that. They don't realize these things are in Medicare Advantage and not in traditional Medicare. And by the time they might run into them, as I said, it's probably too late for them to be able to purchase Medigap, and they really can't personally get out of it anymore. So, these are things that we're saying, and we're saying that the corporations are causing harm, but the corporations are starting to say it themselves right now because they don't actually care about the harm. Recent quote from CVS that they literally are announcing in public at their shareholders reports that they value margins over membership. So CVS has declared that they might be cutting the benefits that they're offering in Medicare Advantage. Hearing, vision, dental, and other things like that. Understand those benefits are not often used, and they're not used, they're not as robust as you probably would want them to be, and they're kind of designed more as marketing benefits than they are as really solid, substantial benefits. But still, there's some degree of benefit. And CVS has announced that even those they might be cutting. They might be leaving counties that they don't make enough money in, unprofitable counties. And they overtly said, direct quote from the CVS CFO, the goal is margin over membership. Margin is how much money they can make. And they might lose up to 10% of their Medicare members. That's okay if they can make more money. So they are declaring margins are more important than membership. Compare that to our side of the coin, where a group called People's Action, a terrific nonprofit organization that I recommend you check out a little bit, has a campaign that we support called Care Over Cost. And they say that people are stuck with bills that they can't pay. And so they have to take money from rent and food and frankly go bankrupt and stay sick or injured and sometimes die. So look at the contrast. Our side of the coin, we're talking about care over cost, and their side of the coin, they're literally overtly talking about margin over membership. The last thing to point out about People's Action, just so you know, their campaign, careovercost.org, if you're a person or you know somebody who's having trouble with one of these denied claims, they might be a resource. They help people appeal those things. So our primary conclusion is that these corporations are taking advantage of us. And one part in particular I want to highlight is that they claim that they are the solution to the terrible inequities in our country. And that's exactly backwards, frankly. They claim that they are the solution to inequities and disparities in healthcare because it is true that people of low income or people of color are indeed more likely to choose Medicare Advantage than to be in traditional Medicare. That's true. And so the industry claims that the fact that there are more people of low income in Medicare Advantage means that they are solving the problems of inequities. Well, that's just not true. That's upside down. So here's just one little data point that's cited in our report that shows that cost-related problems accessing care, particularly by people who are sick, in traditional Medicare, white and black groups have about the same level of problems. Now notice, that's still a big number. Now, we need to do a lot of things to improve traditional Medicare, but black and white is not much of a difference. And yet in Medicare Advantage, if you're black, you have a much higher chance of having cost-related problems accessing care. So it incenses me when Medicare Advantage firms claim that they're the solution to inequities, whereas clearly this demonstrates that they're part of the problem because people that have more financial resources reject that insurance. They don't go into Medicare Advantage nearly enough. So because they don't want to expose themselves to this worse, inferior insurance product. And then lastly, it's particularly an egregious problem in rural communities. So if you're living in a metropolitan area, chances are that roughly 60% of physicians are going to be in a Medicare Advantage network. Maybe not yours, but in a Medicare Advantage network. If you're in a rural area, it's upside down. The vast majority of physicians in rural areas are actually not available to you if you're in Medicare Advantage. And it's already hard to get a doctor when you're in a rural area. So bottom line is we're being cheated by these corporations. And understand, as Senator Warren said at the beginning, they were created to save money and improve care. And yet instead, they're not doing what they were paid to do. They're hurting us. So, of course, in this campaign to expose Medicare Advantage, we need to be sure we protect and not in any way hurt the people that are currently in Medicare Advantage. But for crying out loud, we have to stop paying for things that are bad to us. There's overwhelming evidence that they are hurting us in order to make money. And then lastly, let me just reiterate, there's a lot more in our report that you can get on the website, and our first report talking about the overpayments. So be sure you check those out at our website, and I'm sure our folks are putting up the links. Bill.
Thanks, Ed. Now we're going to hear a little bit from Dr. Claudia Fegan. If you've never heard Claudia speak, you're missing out. She has been a former president of PNHPs, but is currently serving as our national coordinator. And she's been in this fight now for almost 40 years. So we'll hear from Dr. Fegan a little bit about why you should be more involved.
Hi, I'm Claudia Fegan, National Coordinator of Physicians for a National Health Program. My day job is Chief Medical Officer for Cook County Health, the third largest public health system in the United States today. And I hope that you're getting some good information about Medicare Advantage and that you'll want to join us in the fight together. If you feel that there are too many, the wrong people are in charge of healthcare, or if it offends you that tax dollars are being used to increase corporate profit instead of take care of patients, then you should join us in this fight. Every day, I deal with patients who are suffering as a result of not being able to get what they need when they need it. Medicare Advantage plans promise people a lot and deliver a little. They put barriers and obstacles in front of patients. And if you think the wrong people are in charge of healthcare in this country, then you should join PNHP. Join us in this fight. Join a group of people who believe that healthcare should be a right for everyone who lives here. We believe that we already spend enough on healthcare in the United States today. We let too many people who are not involved in the delivery of care to take profit from it. And that's part of what Medicare Advantage does. It promises people things, and then once people are in these plans, they find out that there are all kinds of barriers, whether it's prior authorization or different rules that keep them from getting the care they need, the care they were promised, the care they thought would be delivered. So if you want to be part of this fight and join us, whether you're someone who's a physician who takes care of patients and is offended by this, or you're a patient who has suffered as a result of not being able to get access to what you need, or you have watched a family member try to navigate the complexities of the insurance industry in this country, which is designed not to deliver care, but to make profit, then you should join PNHP. PNHP is an organization of committed folks who want to see a change in healthcare. We think the wrong people are in charge of healthcare. We think the wrong people are taking all of the money from healthcare instead of delivering it to the people who need it most. So join us in this fight and let us help take control of healthcare. We believe that healthcare should be a right to which everyone is entitled, and that we can be successful in our desire to change the course of healthcare in the United States today. Thank you for your time, and please don't forget to sign up for PNHP. We'll be stronger with you in the fight to join us. Thank you.
Yeah, I would join again if I could. I'd love to hear her talk. I mean, it's crazy, right? Twice as many people dying on Medicare Advantage plans when they have cancer. Like, how is this okay? And the government is just sort of standing by and saying, yeah, we'll go ahead and support this. This is crazy. We have to fight. So the next person I want to introduce to you is actually a medical student. That means he represents the future of this movement. Michael Massey is a third year, almost a fourth year med student at Northeast Ohio Medical University. And he is one of our board members from Students for a National Health Plan. And so he's going to tell us a little bit more about his experience with harm at the hands of Medicare Advantage. Michael.
Hello to everyone on the PNHP webinar tonight. My name is Michael, and I'm a fourth-year medical student in Ohio, and I'm honored to have been invited to speak on the personal harms of Medicare Advantage plans related to my grandpa's experience. Unfortunately, I cannot be with you all live, since I will actually be at the hospital during the webinar. I'm grateful to share my grandpa's story. He's always been a role model for me. His childhood was plagued by a violent father who beat him and his siblings and forced him to fight other people when they were out in public. But despite this, my grandpa grew up to be a very straight-laced, self-made man. He began a career as a mechanic after high school and worked his way up until he was running his own factory. He also is a pillar of his community. He's constantly fixing things for people that he knows and doing chores for his neighbors who have gotten too old or too sick to really take care of their house on their own. 2 years ago, though, when he was 78, he was diagnosed with pancreatic cancer. The cancer had not spread, but it was too close to an artery to be treated with surgery. And as a medical student, I wanted to research all that I could to find the best treatment that could help him. And I found a newer treatment procedure that was designed for the exact type of tumor that he had. And I told him to ask his doctors about it, and he later told me that the only hospital in his area that provided that procedure was out of his provider network. So it cost over $30,000 out of pocket. And I said, what do you mean? Medicare doesn't have networks. It should cover you. And that is when he learned that he had a Medicare Advantage plan and not traditional Medicare. Since insurance companies can advertise their plans so prominently and deceptively, many people don't know they aren't signing up for traditional Medicare. Due to his Medicare Advantage plan, my grandfather had to forego the treatment option that would require a lot less chemotherapy to supplement the treatment I found and pursue heavy chemotherapy and radiation. He also had to meet a $6,500 deductible. He spent $35 to $60 for every copay and had co-insurance. 1 year after his diagnosis, he stopped his chemotherapy because he had become too frail with diffuse swelling and had to take 1 ambulance ride and 2 life flights due to passing out and having transient ischemic attacks in his brain and heart. He spent over $18,000 on his treatment, and his partner spent hours per week arguing over improper billing with hospitals and their insurance company. And he had to pay additional out-of-pocket fees for past his deductible for his life flights, which would have been covered under traditional Medicare. My grandpa and his partner wanted me to share their story because they did not think anyone should have to go through what they did. Their biggest betrayal throughout all this was feeling like they had to fight with the hospital and insurance company over surprise billing while still relying on them for urgent medical treatment. It's a powerless situation, and Medicare Advantage plans won't hesitate to squeeze people like my grandfather under their thumb in order to gain a profit. By denying or even just delaying care, they are causing real harm to millions of seniors. Thank you for letting me share my story. Wishing you all the best.
Oh, thank you so much, Michael. So next up, we're going to hear from a physician telling us stories about how Medicare Advantage has harmed her patients. Dr. Diljit Singh is PNHP's current vice president and next president. She's an OBGYN trained gynecologist, oncologist based in Virginia. Diljit, tell us a story.
Thanks so much, Phil. As a GYN oncologist practicing for 25 years, my patients and I have made decisions based on their life goals and basic oncology concepts of starting cancer treatment as soon as possible to maximize chance of cure, avoiding transfusions that might increase chances of the cancer coming back, following the evolving science as Michael was describing. And I used to be relieved when a patient was over 65 because I knew they had Medicare and I wouldn't have to worry about pre-authorizations and denials as long as I was following national guidelines and we could just focus on cancer treatment. As you all have heard, Medicare Advantage has changed all of that, with pre-authorizations needed for any test or treatment and frequent arbitrary denials. Imagine a 66-year-old woman with 2 part-time jobs. She's a receptionist at a local funeral home, tends bar at night, and in spite of all the numbers of hours she works, she's never had health insurance because she had part-time jobs until now. She's been worrying about some abnormal vaginal bleeding that she's been having, but since she was so close to turning 65, she waited until she had Medicare. When it came time to pick a plan, she did all the right things. She researched the programs, she looked at the list of doctors, she asked around. But she did not know that she had cervical cancer, so she did not specifically think about oncology care. She did realize she couldn't afford the copays of traditional Medicare, and so she signed up for the same Medicare Advantage plan as her neighbor, who really liked it because it covered this Silver Sneakers program, although she never used the Silver Sneakers program. First thing after enrollment, she wants to see a primary care doctor, but her Medicare Advantage plan has a narrow network, so it takes months to get in to see a physician. She mentions the abnormal bleeding and then struggles for more months looking for an in-network gynecologist with availability. By the time she sees the gynecologist, she's feeling dizzy when she stands up, and tests show she's anemic, has low blood counts, and the cancer that she doesn't know about yet is causing pelvic pain, making it hard for her to stand. Next comes the search for a specialist like me, but she has few oncologists in her network, and so there's more delay. And by the time she gets to me, having an exam is almost unbearable. But even on a limited exam, I can see the advanced cervical cancer. and I know what we need to do as soon as possible. However, now the pre-authorization process kicks in. We must wait for the insurance to pre-authorize before we can schedule the biopsy. We have to wait until the biopsy comes back before insurance will authorize the PET I know she needs, and that'll help us plan the treatment that we still haven't started. Meanwhile, she continues to suffer physical pain, ends up needing a blood transfusion. And I know I am not giving her the best chance of curing her cancer. And knowing I am not doing the right thing, but having no power to change it. In academics, we call this moral injury. And what moral injury feels like is having something slowly suck the life out of you with every single patient who gets substandard care. And the story isn't over yet. This is just the beginning of her cancer journey. But you all know this story because it's your story, or your patient's stories, or your friends' stories, or your neighbors, or your mother's, a story of someone struggling to get the care they deserve. And these stories are why we're here this evening, making plans to take back the money we have contributed with every paycheck that insurance companies are now taking as record profits. So what can we do? Claudia started that conversation. Phil has been dropping hints. I invite you to join PNHP and become a member of an energized movement of physicians. You met Michael, our medical students are amazing. Our healthcare activists, all the groups that have joined on, they share your values, their commitment, and their resolve, and they're working to achieve comprehensive universal healthcare free of profit-driven conflicts of interest, unconnected to employment, freeing businesses to provide healthcare, freeing people to change jobs, to start their own businesses, to follow their dreams without worrying about where they're going to get their healthcare and the healthcare for their family. Tell us what you've already done in the chat to prevent privatization of traditional Medicare. Have you joined PNHP, shared your story through a letter to the editor, signed our petition, or participated in a legislative visit? While people are sharing their actions in the chat, and we'll reopen that chat, I want to turn to what we're going to do next. We know we need to speak up if we want to protect ourselves and other physicians and patients from the harms of Medicare Advantage. So I'm going to ask you to do two things to grow our movement. A poll will be coming up, and it'll show you the options. First, will you, oops, sorry, my screen just died. So first, will you share a story through a letter to the editor or an op-ed? At PNHP, we have resources that if you click that box, we will send to you resources, information, everything you need for this powerful action. Two, this summer we have two trainings that are happening. Be a Hero is having a month of action in July, and in preparation on June 26th, they're holding a training. And the training is going to focus on the information you need to give people and the thinking about where are the best places to talk with people, where are settings that you can engage in these activities. The second, sometime in July, with a time yet to be decided, and we'll get that information to you, PNHP is having a speakers training to get you the data, the slides, the skills to speak to a variety of audiences. In order to win, we know we need people all over the country trained and ready to expose the insurance industry's harmful actions. Let us know if you can participate, and we'll get you the details. Let's build the power we need to get everyone the health care we deserve. Now I have the pleasure of introducing you to someone who shares our goal of drawing attention to the harms of Medicare Advantage. Kurt Barwis is the president and CEO of Bristol Health in Bristol, Connecticut. He's also a board member of the American Hospital Association and former member of the Board of Governors of the American College of Healthcare Executives. Welcome, Kurt, and thanks for joining us tonight.
Thank you very much for having me tonight. Really appreciate it. And hearing all of the the presentations tonight. I feel like I'm in the right place. So thank you. So let me get started. As you said, I'm the president of a small, highly integrated health system in Bristol, Connecticut. In many respects, the pandemic hid a growing reality for acute care hospitals across this country. We had the emergence of distressed and failing hospitals. It was really just hidden in our country. Yes, we saw a great staffing exodus in our industry. Yes, labor and supply and inflation has been staggering, but all of these environmental forces swing like pendulums, as they always have. Staffing shortages will subside, new creative staffing models will emerge, supply prices will moderate, and the reality of artificial intelligence should begin to improve at least the administrative part of our business. What I see, though, is that Medicare Advantage is the largest threat to sustainability for hospitals and physician groups that have high MA penetration. Medicare Advantage abuse of hospitals, doctors, and other healthcare providers has grown faster than the penetration of these plans. More recently, it seems there's been a groundswell of bipartisan acknowledgement, focus, and attention, substantive changes in MA rules and regulations. Unfortunately, harm to accessing care in many rural communities will never be reestablished, and the threat and concern that more will fail continues. The awareness of denials for needed tests and procedures, the administrative burden and related burnout is no longer being ignored. In the last 2 years, almost 2,000 pages of new rules and regulations were implemented by the Center for Medicare and Medicaid Services, yet building a meaningful accountability system to address and prevent harm to MA enrollees seems totally lost and literally accepted by a healthcare system that focuses on quality, safety, and outcomes. Change, addressing abuse, denials, administrative burden, and costs that are shifted to the healthcare providers by MA plans for their profits is a cancer in the U.S. healthcare system. While CMS is actively implementing meaningful change at a rapid pace, so too are these plans implementing countermeasures to sustain their profit margins. CMS, the largest payer of healthcare in our country, includes in its mission and national quality strategy, making sure everyone is safe. Why is it that prior authorizations have standardized timeframes, 72 hours, 7 days, 14 days? How does it make sense that all tests and procedures, treatments, and medication other than emergencies fall into standardized timeframes? Why is it that MA plans have unchecked ability to expand their use of PAs? With just 2 oncologists in our hospital-based cancer center, we were required to do 360 prior authorizations in 1 month. We were forced to add a second qualified PA person just to ensure that our cancer patients get the care they need. How does this make sense? The system that hospitals and doctors and other healthcare providers exist in requires licensure, credentialing, competency assessments, reporting, including anytime we cause harm, oversight, inspections, all designed to ensure reliability and safety. When a mistake is made, hospitals immediately conduct root cause analysis, construct and implement action plans to ensure that the system that failed is fixed and no one is hurt in the future. There are real consequences for unfortunate mistakes, loss of licensures, fines, and other regulatory actions. In addition, those that are hurt or their families can easily access the legal system and be compensated for harm. Yes, mistakes happen, but the system controls are in place to address them with real consequences. MA plans practice medicine through the prior authorization process, sit through any state hearing, and as we heard tonight, on harm caused by prior authorization. It's heart-wrenching, sad, and totally doesn't reconcile with a healthcare professional's inner rational logic. There are endless examples of harm from patients and doctors. The injury isn't just to patients. There's the moral injury that this causes to an oncologist who full knows that after appealing a denial and doing a lengthy peer-to-peer, that their patient's life will be cut short because they couldn't get the best or right drug approved, or the appeals and approval process took too long to make a difference. Or in the case of a critical care doctor, for a patient that was stuck for months in an ICU waiting for a high-level post-acute ventilator MA authorization, full well knowing that the literature clearly established the longer it takes for a patient to make the transition, the less likely they will recover and the higher the mortality outcome. And then there are the denials that will surely come and the reality that the hospital will never get paid. This is actually a real patient example. Patient was admitted in April of 2023, stayed in my hospital for 7.5 months waiting to get a proper authorization, $2.2 million in charges. And today, we have not been paid a dime by that Medicare Advantage plan that got paid every single month from the federal government to take care of that patient, not one dime. There's no question that the harm is occurring to MA enrollees each and every day, which begs the question, What system is in place to report and hold MA plans accountable when their actions harm enrollees? CMS has an enrollee complaint system, and there is a process for resolving enrollee prior authorization denials. But what is happening to address MA-caused enrollee harm? Where is harm, adverse event statistics, where they're being captured in the CMS star rating system so people can make an informed decision about what plan they might take? It's time to fix this problem once and for all. It's time to stop ignoring Medicare Advantage enrollee harm. Either we take profit out of the equation altogether, or we embrace and implement changes that will cause these plans to put enrollee safety and outcome ahead of shareholder value. I echo with all the prior presenters have said, advocacy, telling the story, building the awareness of harm caused by MA plans, PAs, and adverse impact, and the adverse impact it has on health equity are critical and incredibly important. Thank you for the opportunity to be a part of this webinar.
Oh, thank you so much, Kurt. That's amazing to hear the hospital side of things, so valuable in our fight. Next up, I want to introduce another healthcare activist to you, Jen Coffey, she's a writer, she's been in the healthcare field, she's been a legislator. Jen, take it away. Tell us about how you've been fighting this fight.
I want to say thank you to Senator Warren for standing with us today, as she did last summer in Washington, D.C., along with the New York City retirees. We stood together fighting for traditional Medicare. My name is Jen, and I'm from Manchester, New Hampshire. I'm on a Medicare Disadvantage plan. I once was a fully functioning EMT holding down multiple jobs at once, one of which was a state representative. That all changed when I was diagnosed with breast cancer at the age of 42. Within 1 year, I had 3 surgeries. I'd walked into the hospital and was wheeled out. I lost everything, my career, my home, everything. I was bedbound for over 2 years. I was scheduled for an appointment to sign my DNR, do not resuscitate paperwork. I had developed severe small fiber neuropathy and CRPS, complex regional pain syndrome, the most painful disease known to modern medicine, also known as the suicide disease. Approximately 70% of people with it, from children to the elderly, will consider or attempt suicide. The disease is torture. The pain and neurological symptoms can feel like literally being on fire, walking on broken glass, or other horrific, unrelenting symptoms. I was told ketamine infusions could save my life, but the cost was too much for someone living on disability. I was locked in a bed on opioids and narcotics, which stole my mind and ability to interact with the world. It didn't allow me to live a life outside of what I called my cell, my bedroom. Faced with either giving up and signing my DNR or finding a way to get the money, I started a GoFundMe and I sold everything I could think of, including letting go of my car. The infusions enabled me to get out of bed. They gave me a life worth living. Then things got bad and my illness was progressing. I was forced to ration infusions because my rent went up $400 and my Medicare Disadvantage refuses to cover the cost. My neurologist started me on low-dose naltrexone, but the pharmaceutical company that makes the medication will not make it in the low doses that I need because it's not profitable for them. I have to use a compounding pharmacy to get the medication. I've had to take my struggles public to access the care I need. It wasn't an easy choice to put my pain out there for the world to see. It was my last best hope of continuing my treatments. But I didn't have to do it alone. I had organizations across the country who are working together to fight back against the financialization of healthcare in the U.S. People's Action created a video, a petition, and a letter demanding that United Healthcare cover my care. There was a full-on social media blitz. That Twitter storm resulted in contact from United Healthcare on Twitter. They didn't call me. They contacted me by commenting on my post saying they wanted to talk to me. I went to Washington with Be a Hero and had meetings about my story with Senate staffers. They created a video covering the last year of fighting for access to the infusions I need to live. Organizations like Social Security Works, Rights and Democracy, and PSARA shared and spread the video, getting over 300,000 views just on Twitter. That's 300,000 more folks warned not to become trapped like me. PNHP showed up in white coats supporting me, and I've collaborated with them to further educate elected officials here in New Hampshire. Finally, United Healthcare was forced to cover my infusions, but every single one has been a battle. Each was issued a prior authorization, and then United Healthcare denies it when the bill comes in, going back on the prior authorization. Then I fight more to finally get them to pay. I'm currently still waiting to see if they pay for my March infusion. Last I checked, it was being denied. I've spent countless hours on the phone, losing precious moments of my life to the endless nightmare of fighting to stay alive because I'm trapped in a Medicare disadvantage. I have pre-existing conditions, and no one will issue me a Medicare supplemental policy. We've taken the fight right to United Healthcare's front door at their headquarters in Minnesota. As we sit, United Healthcare had its shareholder meeting today. I imagine them toasting their profits while a child is suffering from cancer, waiting for chemo to be approved. People identify with my story because they've had it happen in their lives and they've seen their loved ones suffer. Last summer, over 1,000 of us showed up to fight in Washington, D.C. This summer, we're taking the fight to every city, but we cannot do this without you. I need you to take the next step in the capacity you can. Maybe that looks like sharing information on social media or talking to your legislators. Maybe it's standing with me at a protest. Whatever it is that you can do to bring us that much closer to saving another life. But without you, who will warn the masses so that they don't become the next medical nightmare, just like me? Will you join me?
Oh, thank you so much, Jen. That's been a fight that you've been fighting. Next up, I want some more details on some actions. So I'm going to turn to PNHP board member and activist, Dr. America, Sanjeev Sriram, a pediatrician and a friend of mine for a long time. Sanjeev.
Hi, everyone. I'm Dr. Sanjeev Sriram, a PNHP board member and a senior advisor for Social Security Works. I want to thank all of our allies for their support in this campaign and helping put together this fantastic webinar. Labor Campaign for Single Payer, Indivisible, Public Citizen, the Center for Medicare Advocacy, People's Action, Be a Hero, and Social Security Works. Thank you all so very, very much. Right now, I hope this webinar has got your anger cranked up. None of us have ever had any love for the insurance companies, but after hearing more about how their greed is wrecking dignity and lives for our patients, it's time to focus our fury into action. Together, we can take the fight to the insurance company greed machines. Let's effing go. Insurance companies have zero shame. They have openly said that this fall they will cut benefits, hike prices, and put profits before patients no matter what. But they have no idea about the hell we will raise for health justice. We need you to join us for a summer of big opportunities. First, this July, our friends at Be a Hero are organizing activities all month long to celebrate Medicare's 59th anniversary. Follow Be a Hero on social media, learn more, and let's show up and show out to celebrate Medicare, how much it means to us, and how we want to protect and improve it. Birthday planning for Medicare starts now, y'all. This August, PNHP will be hosting a training to strengthen our members' skills and raise the alarm about the insurance company's threats to Medicare. This September, we have got a range of actions you can take just before Medicare Advantage open enrollment. In New York, a large group of seniors, doctors, and allies are holding a giant rally to fight being forced onto Medicare Advantage. We want you to have similar events across the country. Gather your friends and coworkers and deliver PNHP's report on Medicare Advantage to your members of Congress. Got an insurance company office near you? Leaflet outside that office. Get sidewalk chalk and lay down art and facts outside that office. Throw a parade, throw a rally, do what inspires you. Let your community know that we do not have to put up with the insurance companies anymore. Right now, we're going to launch a poll asking you a couple of things. Will you join in events in July and August to celebrate Medicare? Will you join us in September? Can you help organize an event in your community? We are here to help you. Let's turn anger to action and take the fight to the insurance companies. A better healthcare system rooted in justice and dignity is possible. Let's effing go.
Yes. Thank you, Sanjeev. Anger into action, people. That is what we need. So we're at the top of the hour, and I want to thank you all for spending your hour with us. First and foremost, I have to thank Senator Elizabeth Warren for her fight, her commitment to this. But I want to thank all of our speakers, Sanjeev, Jen, Kurt, Diljit, Michael, Claudia, Ed. Y'all are amazing and proof of the strength of this work that we're doing. I've got to thank our supporters, right? You heard them. Social Security Works, Be a Hero, such a partner, right? Centers for Medicare Advocacy, Public Citizen, Indivisible, People's Action. Y'all have all been so amazing in this fight. We need to continue working together. And so remember, tomorrow, you are going to get an email with all of the slides from tonight. You're going to get a recording of this. You are going to get the tools to fight this fight yourself. Now, what else can you do? Of course, we want you to join as a member, but you don't have to be a physician to join PNHP. Anyone can, right? We will work with you. We will direct you. We will help you organize. Or if you don't want to join as a member, we'll take your donations. Donations over the last year really enabled us to hire additional good work. So we are continuing to grow as an organization. We need your support as well. And it's making a clear impact on the movement for healthcare justice here. So remember, when you get your email tomorrow, share this report, right? Share the news, tell people about it, right? Speak up to everyone you know. And finally, stand up, show up when you have the chance to take action. Join us if you can. We love it. Support us if you can. But most importantly, join us in this fight. It's time to say no to Medicare Advantage. It's time to take our anger and turn it into action.